Okay. So, shouldn't be that big of a concern because you've already done that, right? Talked about parasites, diagnosed them. So, let's get into it. When we're looking to diagnose parasites, you have to understand that there's not one method that works for all parasites. And the reason is because parasites live in different areas. So just because somebody does this test, it's not going to diagnose a specific parasite. And a lot of people don't understand that concept. And they'll do a simple test and say it's negative. Well, if they did the wrong test, it's not going to show up what it needs to show up. So you have to do the correct test for the specific parasite. Parasites can be detected as adults. You can see them. For example, lice. You can see lice, you can see mites, you can see ticks pretty easily. Sometimes the tests we do for parasites just look for the offspring, whether it be the ova or the eggs or the larvae. Occasionally, especially for parasites that get into the blood or into the tissues, you can do serology. And in serology, you're looking for the antigen itself. And where does the antigen come from? It's part of the parasite. Or you can look for the antibody, which is the body's response, the immunologic response to the antigen from the parasite. Our bodies are meant to produce antibodies, not antigens. So the antigen comes from something foreign. One of the biggest reasons I've had a problem with the COVID thing from the start. It was not an antigen. It's a genetic therapy, gene therapy to tell your body to produce the antigen. The body's not meant to do that. It's never meant to produce the antigen. If the body produces antigen, it usually leads to bad things like immunologic problems. Okay? So, we produce the antibody, not the antigen. The antigen is from the foreign substance. Okay? So technically, the COVID shot was not a vaccine. By definition, a vaccine is the introduction of an antigen that's been altered so that the body will produce antibodies. Well, it wasn't an antigen, so it's not a vaccine. Okay? All right, now the procedures that we do, we have to look at the procedures and decide how reliable are they. And reliability measurements for tests of any kind essentially come down to two things: the sensitivity of the test and the specificity of the test. Those are two different things. If you're looking at sensitivity, the best way to define sensitivity is what is the true positive rate. In other words, if you do a test, if it shows positive, what are the chances of it being really positive? Okay? The more potential it has of being truly positive, the more sensitive the test is. Does that make sense? So, if you do a test and it says positive, that means the parasite is there. It may not be visible, but at least you know that the test was positive. False negatives can occur with tests. That means you do a test, it says negative, but the parasite is there. The test just didn't detect it. That's a false negative. And in those cases, multiple tests might be required to truly figure it out. One test alone may not be enough. Okay? Especially if you consider, you're looking at it, you've seen all of the signs say, yes, this parasite's there, but your test shows negative. First thing I'd be doing is contemplating doing another test. Make sure I didn't screw it up somewhere. Those tests need to be correlated with the clinical signs of the patient. Okay? Now, the primary reason that sensitivity is so important is to rule out the parasite. Is it there or not? If it's a very sensitive test and it says negative, there's a high likelihood that the parasite isn't there. Yes, false negatives could occur, but that doesn't usually happen. You have to use a little clinical acumen to figure out, do I need to do another test? So that's sensitivity. Then we look at specificity. Specificity talks about the negative aspect, the negative results. So if it's negative, is it really negative? That's specificity. So if there's a negative test, is it really negative? That means the parasite's not there. Unless it's a false positive. And false positives can occur. Sometimes it occurs because you see something that looks like it could be a parasite, but it isn't. Okay, so that would be a pseudoparasite possibility. For example, if you're doing a fecal flotation, if you look at this thing under there and it looks like an egg from a parasite worm, it could be pollen. It could be a pollen grain. It looks just like an egg. But it's not an egg, so that means it would be a false positive. Okay? So basically, specificity is tests to rule in the parasite. And what you want is a test that has very, very few false positives. So if that's the case, you have a very specific test. The whole idea is that the sensitivity and the specificity are really high. If you've got that kind of a test, it's a pretty good test. Okay? And you can pretty much count on the results. Okay? Now, when we're doing diagnostic tests, one of the methods we use for diagnostic testing is we do fecal samples. And in fecal samples, a lot of times we're looking for ova or the larva of the organism, okay? Because a lot of these organisms live in the GI tract, that's where you can find the ova or the larva. And it can be anywhere from the esophagus all the way down to the intestines, even including some of the ancillary digestive organs like the liver and the bile ducts. Now, that would be just ova, the eggs, or the larvae that are just kind of crawling around. Sometimes these things can be in the respiratory tract. And in the respiratory tract, the way they get back into the GI tract is they migrate through the pulmonary system. They get into the bronchi, the mucociliary escalator takes them up into the area where they're going to be coughed up or brought up and then swallowed back down into the GI tract, like toxicaricanus, okay? Now, when you do fecal samples, there's a few criteria. Number one is it needs to be a fresh sample, okay? Because the ova that are in there, depending on what they are, they can change real quick. They can go from ova, they can hatch. Larvae can change real quickly. And even protozoas can change a lot from a motile giardia to one that's encysted. Sometimes old fecal material, or that's been sitting out for a while, the ova may have embryonated. Now it's going to be really difficult to tell what they are. The oocysts, if it's some kind of a protozoa, like coccidia, those oocysts may have sporulated. And now it's going to be really difficult to identify them. Sometimes protozoans are dead, and if they're dead, you're not going to see much, especially if there's motion or motility involved. And then occasionally, you're going to see pseudoparasites. For example, if I go out in the grass out there and I pick up a fecal sample that's been sitting there for 3 or 4 days, and I bring it in, I start looking at it, and I think, wow, there's a worm in there. What's the chances of that not being a parasite? It could be a maggot, because a fly laid an egg on it and it hatched out and now you got a maggot in there. But that's not a parasite of the animal. That's just because it was laying on the grass. Okay? So, when we do fecal samples, it needs to be a fresh sample and you need to run it as quick as you can. Hopefully less than an hour. If you can't, then you probably should refrigerate it, and then that should slow down the changes in the parasite. Okay? Either ova or larva. When you do a fecal submission, or when you get a sample, it should be sealed. It should be sealed in a glass or a plastic container. I've always had a problem when people bring in fecal samples in plastic bags. like a bread sack or whatever. And it's open to the environment. And you never know what's going to happen. Besides, it's kind of disgusting. Okay? Now, that sample submission should be labeled on what day it was collected, who the client is, the patient, the species of that patient, and then any observations of elimination characteristics need to be recorded. Like, what color was it? Is it formed? Is it wiry? Is it mushy? And then if there's anything visible at the time it was found. Okay? Not necessarily 3 days later, but when it was found. Was there anything that was seen? All of that's really important. And when you get a fecal sample submitted, it needs to be about the size of the end of your thumb. In other words, about at least 1 gram. Okay? Well, how much is a gram? How many grams in a pound of butter? You guys should know this. How many grams in a pound? Automatic response should be 454 grams per pound. So that means it's going to take 454 equal amounts to create 1 pound. Okay? Now, the best way to get a fresh sample is to actually witness it being eliminated from the body. Okay? That means if you're watching them defecate, you can actually see the characteristics of the defecation. Whether if it was normal, if it was a difficult defecation, was it diarrhea, was it mushy, like a cow pie, or was it hard? Okay? All of that can be eliminated or written down on your findings because you watched it happen. Now in large animals, that can be tough, especially if they're running around on the back 40. But the neat thing about large animals, I can fit my hand inside the rectum. So a lot of times, I'm going to reach in and I'm going to get my fecal sample out. Then I know it's fresh. Okay? But obviously, if you're going to do that, make sure you wear gloves. Okay? Insert the hand, lubricate it well, grab some fecal material, bring it out, and then put it in the container. If it's grouped animals that you're testing, like a herd, trying to do that is kind of a pain in the butt, going down a whole line of animals. So in those cases, you should be doing testing for groups, but those animals have to be in contact with each other. I'm not going to take a sample from a room and think it's going to count for all of the animals in that area if they're not in contact. Because if they're not in contact, the chances of them passing it from one to another is pretty low. So that's why pigs are usually raised in contact in big farrowing houses and out in a feedlot for a dairy or for a beef cattle. You can do that. But it would be a good idea to get multiple samples, okay? And then you can either run them individually or you can mix them. If the animals are in contact and the sample shows positive, what's the likelihood of all those animals in contact having the parasite? A lot higher, okay? Now, the thing about doing fecal exams is, number one, you have to understand this is a human health hazard potential. So wear protective equipment, wear gloves, wash your hands, do all that stuff. It's pretty normal. Don't eat and drink when you're doing stool samples. That may sound really dumb to say. You have no idea how many times I've seen people sitting there eating their sandwich and they're looking at a fecal sample and they just ran. It just drives me nuts. Okay? It doesn't make any sense. And then don't put on your makeup or don't put in contact lenses if you've been working with fecal material. That's kind of gross. Okay? And then when you're done, please clean up the area. Now, here's a really novel concept. When you clean something up, you know what the rule is? Make it better than when you found And that's what my rule is. If I go out to a clinic and I'm doing surgery in a clinic someplace, I always make sure that when we leave, it's cleaner than when we got there. Then I never have to worry about it. So when you clean up, put things back, make sure the equipment is cleaned up, and make sure the area is cleaned up. And if it's better than it was when you found it, you can't get any better than that. And then the next person makes it better than when they found it. So just make that one of your rules. Clean it up so that it's better than it was when you got there. And if you don't put things away and the next person comes along and sees a mess, you're not going to be too happy. Okay? Now, when it comes to records, you have to make sure that if you're doing these things, you keep records. Okay? You have to keep records about the sample and the data that's received when it comes in. But then you also have to record the results. Is it positive? Is it negative? What did I find? All of that stuff has to be in the records. Once the record is done, you have to sign it or indicate somehow with your initials or whatever that you're the one that did that. Okay? Now, sometimes when we're doing fecal exams, we start out by just looking at it grossly. We look at the consistency of the stool. We look at its color. Decide whether or not there's blood in it. If it's blood, there's two different options. It's either frank blood or red. If it's red, that means it's coming out of the GI tract someplace far caudally or in the GI tract. It didn't come from the stomach and it didn't come from the small intestines. Because if it does, by the time it gets out the back end, it's usually black and tarry. Okay, that's called melena. So if you see black and tarry looking stuff in the stool, there's a good chance that there's bleeding someplace high up in the GI tract. Then you're going to look for mucus. Mucus is sometimes secreted by the colonic cells in response to irritation. And so higher levels of mucus might be noted. And then sometimes parasites. You can actually see them in some cases. Tapeworm proglottids, okay, especially like Diploidium caninum. You've already seen them. If that one comes out, you can see these little tiny rice-looking things. Sometimes they get all dried up. You think, wow, what is that? Well, take it, put it in a little jar of water, and then wait for a little while. And then after a while, it gets hydrated again, and it looks like a tapeworm sample. Roundworms, occasionally you can see those in fecal material, especially if they've given drugs to treat roundworms. Because oftentimes the drugs make those roundworms pass out in the stool. Okay? But you have to make sure that you're not looking at larval arthropods that are put there after the fact. Now there are some larval arthropods, and what's an arthropod? What does that mean? Jointed foot. Like? Flies. Okay? Ants. Those are arthropods. But arthropods that might have larvae in fecal material would be like the botfly in the horse. Okay? And that larva can pass out in the stool. And you can actually see them in there, as long as you get it fresh. If it's an old sample, now you have no idea. Now, fresh proglottids, pretty easy to tell what those are. You can take one of those, you can put it under a microscope slide, or put it on a slide and look at it, and you can actually see them. And based on the appearance of the proglottid, you can tell a lot of times what kind it is. Okay? Like this here is not diploidium. I can tell because the pore, the genital pore, is only on one side. If it was diploidium, it'd be on both sides. And it would look more like a grain of rice. Okay? So you need to be able to tell or know what they look like just by looking at the proglottids. That's really an important thing, because if I diagnose the second one on that colored slide, the big one, then what's happening to that animal? How is he getting it? It's not diploidium. The second, the big one, that's tenium. How does a dog get tenium? Huh? Like what? That's human table. This is tinea from dogs. He's eating raw rabbits. He's going out there and killing something and then eating it. Okay? Do the owners need to know that? That'd be a good thing to tell them. Okay? So just being able to identify the proglottids in tapeworms is kind of an important thing. If you can't, one thing you can do is take that proglottid, put it on a microscope slide with some saline, a drop of saline, and then cut that up or crush it up. Then look at it under the microscope slide. You've now released the ova, the eggs, and by looking at the eggs, you can tell what they are. I can tell you real simply, this is tinea, this is Dipylidium caninum. Now I know what I need to talk to the owners about, okay? If they're desiccated, again, put them in some saline, moisten them up, and then crush them up, okay? Now, roundworms, a lot of times you can see roundworms on fecal material, again, especially after they've been treated, okay? Or if it's a really heavy infestation. And when you look at roundworms, they are round in cross-section, and they're kind of long and tapered at both ends. They don't look like spaghetti, okay? They're more curled up. And sometimes they're actually curled in a circle or a spiral, okay? Now, botfly larva, again, botflies is a specific kind of fly that they lay their eggs on the hair of a horse. The horse goes down and licks its hair. They swallow the egg, it gets down into their stomach. It hatches and attaches to the inside of the stomach until such time as it's released, and then it passes out the fecal material. Okay? And they look like fat little worms. Okay? Pseudoparasites are pretty common too, especially if you don't get fresh samples. If a fly lays an egg on a fecal sample and then it hatches, you got a maggot. But that's not a parasite. And then sometimes, again, pollen grains. If you just saw that in a fecal sample, wouldn't that look like an ova? But that's not. That's just a grain of pollen. Sometimes it's pretty tough to tell. So I would do another sample. We'll look at another area. Now, when you're looking under a microscope for parasites, there's scanning techniques that work really well, depending on the magnification that you need. Sometimes you got to go all the way up to 40 power to see these. But when you scan, you have to scan in a specific fashion so you don't miss anything. Very rarely is oil immersion needed for parasites. Rarely. And the thing is when you're doing flotations, that means there's a slide with a cover slip, and in between that there's a fluid. Where are you going to put the oil? The cover slip? You could, but then it's going to move all over the place when you move the microscope slide. So oil immersion is very rarely ever needed for parasite exam. The 40 power is real common. And when you scan with a microscope, you're going to do a complete search using the battlement technique. This is how you scan a microscope slide. Move down, when you move it across, you pick out a little spot on that slide, and you move to that area and stop, right, where you picked up that landmark. And then you go up, and you move across, and then you come down, until you scan the whole thing, okay? This way you can make sure you're not going to miss something on that particular slide. If you're putting it on there and just moving that thing at random, I promise you'll miss something. Okay? So we use the battlement technique or pattern to look and search microscope slides. When you focus, a lot of times we're focusing on or looking for eggs that float, right? So where would you expect to find those? On this microscope slide part or closer to the cover slip? The cover slip. Why? Because they float. What else floats? Air bubbles. Air bubbles are really simple to find. And you focus on the air bubble and you should be in the right plane to look for ova. If you can't see that air bubble really clearly, you're probably in the wrong field or the wrong depth to look at ova. Okay? Now, sometimes we do direct smears. We take a section or a small sample of the fecal material, we put it on the slide with a drop of saline, mix it up with a little Q-tip type applicator, the wooden stick applicators, then put that cover slip on there. Once that is on there, then you're just going to do a real quick scan using the Battleman technique. The problem with doing this is it's a big amount, but there may be very few eggs, so it might be hard to find them. You have to look really closely. So that means if you see nothing, you may not have picked the right sample of fecal material. So you could get a false negative. Well, false negatives aren't really helpful because you want this test to be very sensitive, right? So using a direct smear may not be the best way unless it's really loaded. And then the reason that this is helpful is now I don't have to wait for a flotation. I can smear it on there, I can look. If I get my diagnosis, great. And I wouldn't even have to use a centrifuge. For mobile protozoans, such as the sarcodinians, okay, that swim around in fluid, okay, this might work really well as long as they're modular. Because now you've got saline, you just kind of spread it out, you can see them actually swimming around, okay, like Giardia. Now, flotation requires there be a difference in the specific gravity of the ova and the flotation media or solution that you're using. Most flotation solutions have specific gravity somewhere around 1.2 to 1.25. If the specific gravity of the ova is less than that, they're going to float. Well, most of the ova specific gravity are somewhere around 1.1, 1.2. So if the specific gravity of my solution is above that, the eggs will float. If the ova specific gravity is more than that, they're going to sink. Okay? Most of the fecal material specific gravity, like the waste products that didn't get digested or whatnot, that specific gravity is 1.3, usually and more. So it usually settles to the bottom. You overflow to the top and you can find them. A lot of the solutions that are used for flotations include sodium nitrate. That's one of the more common ones. And then sugar solutions that you can make yourself, and that's called Schieffer's solution. We've got a whole bunch of that in the clinic. And all it is water and sugar and a little bit of formaldehyde to help preserve it. You can use zinc sulfate, that's kind of common, or magnesium sulfate. Magnesium sulfate, everybody knows what that is, right? You go across the street by it. Huh? Probably. Anybody ever use that, buy that, soak in it? Okay, that's what that is, except from salt. Now, you guys know flotation. A simple flotation, you've got a container, and you put some fecal material in that, and then you have to mix it completely up. Now, these little fecalizers are really handy. You put the sample in, or you take the sample container out, poke it down inside it until it fills up, put it back in the container, put some flotation media in there, don't fill it to the top, and then you spin it back and forth, back and forth, back and forth. And the little thick wings on the inside of the flotation device will help mix up that solution. Once it's mixed really well, then you fill it with the rest of the way with the flotation media until it creates a meniscus. And that meniscus is the little curved portion on top. Once that's there, you drop the cover slip on it. It's going to just sit there, and the eggs will float up. In about 10 to 15 minutes, you're going to read this. Take the cover slip off, put it on your microscope slide, and then start doing your exam. Okay? Now, that can be very effective But the more effective way is actually to do a centrifugal flotation. And this is really going to take advantage of that specific gravity difference. Okay? And it gives us the opportunity to find more ova even than a regular flotation. And it takes less time. You don't have to wait 10 to 15 minutes. The thing you need to have is either a swing arm centrifuge that allows it to swing out, or one that's fixed in that kind of a position. You're going to take your sample, put it in a 15 mil centrifuge tube, and then you're going to put some saline in, or some kind of flotation media that will allow it to float, depending on specific gravity. Now, depending on your centrifuge, especially swing arm types, you need to make sure you have a counterbalance on the opposite side, okay? Because it's mobile. If you don't have a counterbalance, it'll put your centrifuge out of balance, and it'll screw it up, okay? Then, once you do a simple, or put that fecal material in there, put your flotation media in, you're going to mix it up, and you're going to centrifuge it for 3 minutes at 1,500 RPMs. Then you're going to take the fluid and you're going to decant it, okay, and get rid of it, add a little more of that solution and resuspend it, and now spin it down again. And then when you're done, you can put that on there and actually look at just the fluid, or to be safe so you don't get your microscope all disgusting, put a cover slip, and then read it. Just the same way we did the simple. Now that works really well if the ova have a very low or lower specific gravity than the flotation medium. If the ova that you're looking for, specific gravity, is more than the flotation medium, they're going to sink to the bottom. And if they're the kind that will sink, then we probably should use a fecal sedimentation method to look at these things. And generally with these, you just use water, okay? The ova are pretty heavy, the specific gravity of water is pretty low. You're going to put the sample in there, mix it up a little bit, the ova will then sink to the bottom, okay? This is especially useful in trematode ova, okay, or flukes. And if you're looking for flukes, those eggs are usually pretty heavy. So we want them to settle to the bottom. The bad part about this is the fecal debris that's in there, the non-ova stuff, that's also going to sink. But if you do it right, you can actually concentrate those ova at the bottom. This isn't done very often in small animal practice, because more often than not, we're not looking for trematodes. We're looking for something else that the ova actually will float. Now, when you're looking, again, for any of the procedures we talked about, we're looking for certain parts or certain evidences like ova or larva, or in some cases like protozoa. You're actually looking for the cysts. Okay? Now sometimes you're not going to see the cystic forms, especially if they're mobile trophozoites. They may not form cysts, or you might have a patient with diarrhea that's being caused by the protozoa right then. So in that case, they're going to be swimming around. If that's a possibility, you're just going to do a direct smear with some saline, okay? And then you're going to look at the motility patterns. And the reason you use saline is because that may decrease the potential for them to change. Okay, you don't use water, you use saline in this case. You can stain a lot of these depending on what kind of protozoan you're looking for. A lot of times iodine, just simple iodine, works really well because it stains them to the point where you can see specific characteristics, like what looks like the eyes or the organelles on the inside. If you let those samples, put them on the slide and then let it dry, then you're going to have to use a differential stain like Diffquid. And that's the one you guys are used to. It's got the fixative, it's got the hematoxylin, and then it's got the eosin. Okay, and you put it in each one of those. And then you can see your parasite. Now, there's some other procedures that we use for looking for parasites. One of them is the cellophane tape method. This is one that works really well if I'm looking for Oxyurus equi, okay, or pinworms for horses. We saw a little video of how the female comes out and lays eggs and leaves that sticky stuff all over. Well, when the sticky stuff dries off, you can't see that. But if you take a piece of cellophane tape, okay? Now, when I say cellophane tape, it's really important you understand that you don't get the kind that disappears when you put it on something, okay? The transparent tape when you stick it on there, because it's always cloudy. If you're going to use cellophane tape, you have to get the clear cellophane tape. That when you look, you can see right through it. Not the stuff that has a cloudy appearance, because that won't work. The cloudy stuff will scoop it up. So get clear cellophane tape. You're going to loop the tape around your fingers, hopefully with gloves on. Loop it around so now you've got that little bit of tape that goes around, and you're just going to roll your fingers. And as it rolls around, it's going to pick up what's ever on the hair. Kind of like a lint roller. And now you're just using a little one that you made yourself, and it's clear cellophane tape. Okay, does that make sense? Now, if you're going to use it and not roll it on your fingers, just put it on the tongue depressor. So you take the clear cellophane tape, you put it on the tongue depressor, then you fold it over with the sticky side up, put the other side down on the tongue depressor, and you can go just touch the tongue depressor. Once it's there, you're going to just take that tape, you're going to take it off, whatever you want, and just stick it on the slide. And this time, you're going to put it sticky side down, so that now it's stuck. Whether or not you add water to it or not, it's entirely up to you, and whether or not you can actually see things. Okay? And a lot of times you can see them pretty easily when you're doing the cellophane tape method. Now, the Behrman apparatus, did you guys do this in clinic paths? Where you're actually doing a sedimentation. You're making them sink to the bottom. Okay? The Behrman apparatus is what we're doing primarily to detect larvae. Okay? So larvae can be in fecal material, depending on which parasite. It can also be in dirt. If I'm looking for larvae in dirt or moist, sandy material, what would I be looking for?
And Xylostoma Brazilian. Oh, okay.
Hookworms. Okay? And you can actually find them. You go out and get a spoonful of dirt, you put it in a Behrman apparatus, and you can actually sediment the larva at the bottom. What you do with that is you take your sample, whether it be fecal material or soil or whatever, even tissues, that you macerate up. Put it in and grab a piece of cheesecloth, and then you're going to put warm water over it. Let it sit. That warm water stimulates the larvae. They start getting very, very active. And they will leave the sample, kind of crawl through the cheesecloth that wraps it, and when they get out into the other area in the funnel, they sink to the bottom. And as long as the bottom is plugged off, and it's got a clamp on it, it will just accumulate right there in the bottom of that tube. Then you take that little clamp, you open it up, take a little bit of that fluid out, and put it on your microscope slide. And then you can actually see the larvae either from the dirt or from fecal material or tissues. Okay? So you're just making them sink, the larvae sink to the bottom, and you pour them out of the bottom of that little catch tube. Okay? Did you guys do that? My guess is no. Okay? Because it's not really a common test that's done unless I'm specifically looking for larvae. Well, how often do we have to look for larvae here in Las Vegas? But if you were in Louisiana, different story. Okay? All right. Now, blood parasites. Looking for blood parasites, obviously you got to get samples of blood. When you're collecting samples of blood, you have to collect that blood aseptically. Okay? You're going to do an alcohol wash of the skin to get into the blood bank, and you're going to pull it out. You put the blood, Uh-oh. Somebody dying? Hopefully that's not a word for the college.
No, it's her phone.
All right, when you collect the blood, you put it in a purple top tube. The purple top tube has an anticoagulant in it, and it minimizes the distortion that might happen. Sometimes you're doing a red top tube, but if you're doing a red top tube, the blood's going to clot. When it clots, you can't look at it anymore. But you can spin the blood down and get the serum, and now you're doing an antigen or an antibody test. You're doing serology. Okay, so those are the kind of tests you use for blood. When you're looking at blood, if you're thinking that you might actually see something in it like microfilaria, you're just going to do a blood smear. You guys already know how to do that. We talked about that when you're doing differential blood cell counts, right? So you just make a smear, and you're going to stain it sometimes, and then you're going to look at it under a microscope. A thicker smear might be good, but the more thickness there is, the more chance you have of missing something, unless whatever's in there is moving around. And then you can actually see it moving blood cells around. Sometimes we look at the Buffy code. Well, the best way to see the Buffy code is to do what? What kind of test? PCV. You already put it in the tube. The tube has an anticoagulant in it. You spin that down, and then you can see the red cell layer, and then you can see the serum layer or plasma layer, and then in between the two is the Buffy code. Sometimes all you need to do is put that microscope, or not the microscope, the PCV tube on the microscope slide and just look at it under low power. And sometimes you can see these things wiggling around in there. We do that if I'm really concerned about heartworms, okay? Direct smears, heartworms, sometimes protozoas, okay? Like Babesia or some of those other kinds. Occasionally we do what's called a modified Knots test. Now, for some reason, this is still in your skills log, I think, okay? Which to me is dumb, but did you guys do this? You should have taken the blood sample, you should have put it in a little bit of formalin, or a little formalin in the blood, that kills everything, and then you do your smear. When we're doing modified Knots tests, the two primary parasites we're looking for are Dirofilaria immitis, or what's now called Acanthocylonema recondita. It used to be called Dioctophyma, I think. It's a long time ago, but they changed the name. That's what parasitologists do. They change the name of the parasites, okay? But what you're actually looking for then is the parasite on the microscope slide. It's dead, and it usually has certain characteristics that you can pick out to differentiate between heartworm and the other threadworm. Now, if it's an immunologic test that you're doing, that means you're looking either for antibodies or antigen, okay? Occult heartworm tests are done this way. Occult means they have it, but you can't see the parasite. For occult heartworms, you're not going to see microfilaria. You're going to be looking for immature adults or single-sex infections. And that can happen, where you only get one gender of heartworms. Remember, there has to be two. So if there's only one gender, you're going to see microfilaria. No. So you have to do an occult heartworm test. This thing, when you do these, you're going to look for the immunologic response, whether it's an ELISA test or some other kind of test, to show that there are either antigen or antibodies to the antigen in the blood. Okay? And you guys hopefully ran some of these. Yes? Yes. Okay, good. All right, now, respiratory parasites. Diagnosing respiratory parasites. Some of them you can find on fecal diagnostics, like doing a flotation or a sedimentation, okay? Nematodes and trematodes can be found with respiratory parasites. And that means it could be either eggs or the larvae that you find on your examination. Because remember, if they're in the respiratory tract, they usually stimulate some kind of a response. They come up, and they're coughed up, and they swallow and go into the GI tract. That's why you can see them on fecal exams. Sometimes we actually have to do a tracheal wash for certain types of parasites. That means you're going to put some fluid into the trachea, slosh it around a little bit, and then suck some of that back out, and then look under the microscope, either with a direct smear or you're going to centrifuge it so you can get them concentrated in a certain area. Occasionally, we're going to find certain types of things like Dictyoculus species, okay? And then we can see those things on a tracheal wash, okay? Sometimes we also do nasal swabs for the respiratory parasites. And when we're looking at respiratory swabs or nasal swabs, oftentimes we're looking for nasal mites. And nasal mites are big enough that you can see them, even with just an otoscope. You put that in the nose, you see these little white things crawling around inside the nose. Those animals are usually pretty uncomfortable because you can feel that crawling around in your nose. And so they're constantly sneezing and rubbing their nose, okay? Do you know what one of the primary suspicions for causing GDV is in dogs? Gastric dilatation and volvulus? Nasal mites. Okay? Kind of a weird thing to think about. The other thing that you can see with nasal swabs are the eggs for tongueworms. And a tongueworm is a real disgusting little creature that lives inside the mouth, under the tongue. Urinary parasites, again, like Dioctophyma renale, the eggs are going to be in the urine. So you got to go do a urine sample. And you can do free catch. Once it's free caught, you can do a sedimentation of it, you can do a centrifugation of it, and then look at the sediment under a microscope slide. And again, Dioctophyma renale, one of the biggest brown worms that we have, that's the renal capsule, and inside of it is the worm itself. And they can completely destroy the kidney. But the eggs are still going to be released, going to go down through the ureter, into the bladder, and then released from the body. All right, now we get to diagnostics for ectoparasites, or the parasites that live outside. We haven't really talked about them yet. That starts next week, I think. But the ectoparasites can be found because they live in the skin by skin scrapings. Arthropod mites can be found that way, but it depends on which mite you're looking for. Some mites live really deep into the dermis. You have to scrape really deep. And if you're not scraping deep enough to get a little blood on the scraping, you're not scraping enough for some of these types of mites, okay? Specifically, if we're looking for sarcoptic mites or demodectic mites, you have to scrape pretty deep, okay? If you're looking for superficial mites like Chilatiella or Coreoptes, you don't have to scrape hardly at all. Just a couple of little passes with the blade. And sometimes all you need is to do a little Scotch tape and you can find these because they live closer to the surface. The technique for doing a skin scraping is really simple. Hopefully you guys did that today with your kiwis, okay? You use a number 10 scalpel blade, not a 15. Okay, and everybody understands why, right? Because the cutting surface of the 10 is right on the edge. The 15, you got to go up inside, which usually means you scrape too hard, and it can cause more trauma. But a number 10 blade, a little bit of mineral oil, and then you slide, usually with a cover slip, but sometimes you don't need it. You're going to hold the blade 90 degrees to the skin, okay, and then you're going to put a little mineral oil on it, you're going to start to scrape, okay, depending on the depth that you need. If you need a deep scraping, you've got to get down to where you're getting a little bit of blood, okay? Because remember, where's the blood vessels in skin? In the dermis. You've got to get through the epidermis into the dermis, so you're going to see blood. Then once you've got that material, you're going to put that slide or spread it out on a microscope slide, put the blade and spread it out, and then you're going to look at it, okay? Again, with or without a cover slip. It's a pretty simple technique, but you've got to know which parasite you're looking for. If you're looking for Demodex, which is probably the more common one around here, it's got to be a deep scrape, okay, down to the point where you're getting some blood. Cellophane tape works really well, again, for the superficial mites, like Coreoptes or Chilottiella. And then you're just going to do that technique we've already talked about. The red sure is the clear tape, not that transparent stuff that disappears when you stick it to something. It has to be clear, not cloudy looking. Put the sticky side down or out so that when you push down it sticks a little bit. Then you pick that up, put the sticky side down on the slide. Because it's clear, you should be able to look right through it. Ear swabs is another way to look for external parasites. Specifically, if we're looking at small animals, we're looking for Otodectes cyanotus. And these things are really tiny, but if there's a whole bunch of them around, sometimes you can actually use an otoscope and you can see these white little things crawling around. Okay? But if you can't, you're just going to take that swab, you're going to put it in the vertical ear canal, never down into the horizontal canal, because if you go that far, you could be pushing debris into the eardrum. You're going to go down into the vertical canal, you're going to kind of spin it as you're getting your sample. You bring it out, and then you're going to roll it onto the slide, because you don't want to push it down and spread it. That's just going to push the bugs around instead of letting them stay on the slide. Once you've found them or you've got it rolled out, then you're just going to look and you'll see these things. And Otodectes is really easy to identify. Here's a breeding pair, there's another one that's not. Those are Otodectes eggs. Okay? They're really easy to diagnose if they have a big infection. One of the things you'll notice with these is there's usually a black, disgusting kind of ear debris. And it's usually kind of dry, not sticky and tarry, it's dry. If we're looking for larger parasites, okay, those are easy. You can just see them with your eyes. Like fleas. If I'm looking and I'm thinking fleas, I'm just going to start parting the hair. And usually you can see them running around inside them, okay? If you see it, you've got your diagnosis. But what if you part the hair and all you see is little black specks? Well, that could be flea dirt or flea feces. But what do fleas eat? Blood. When it comes out the south end, it's black. Unless you take a few of those black specks, put them on a white cotton ball, and put a drop of water on them. And then wait for a few seconds. If it ends up with a red ring around it, it's flea dirt. That means the animal has fleas. Now, they may not be on the animal, but that's because fleas don't necessarily live on the animal. They have a whole part of their life cycle that's out in your environment, in your carpet or in your bed or whatever, okay? So not unless they're on the animal, or flea dirt's on the animal, you're going to find them. Ticks. Ticks are really easy to figure out, okay? In order to identify which tick you got, you have to take it off and look at it. And then you can figure out what species it is. Biting flies are easy to diagnose. You see them, okay? Like a horsefly. That big horsefly over there, yeah. He's easy to see, but you're not going to see him on a pet that's in the house. You'll see these outside. You have to watch the animals, see if they're landing on them. And if they bite, these hurt. Anybody ever been bitten by a horsefly before? It hurts. You should see their mouth parts. They look like little knives. And they actually cut right into you. And then myiasis, another one. Myiasis technically shouldn't be in the tissues, but if the animal isn't taken care of, if the animal is neglected, then flies can lay their eggs in the hair. If it's really disgusting in there, those fly eggs will hatch and those maggots start crawling around. And they start surviving on the body tissue secretions, not live tissue. Most maggots don't eat living tissue. There's only one that I know of that does. And that's a reportable disease. But meiasis is when they got maggots. And one of the best ways to tell maggots is you can smell them. And it is horrific. One of the only smells in vet medicine that makes me want to throw up. It's that bad. I've even pulled rotten calves out of cow uteruses that don't make me want to throw up, like meiasis does. Now, ocular parasites, the one that live inside the eye or in the conjunctival sac, the best thing you do is you just look, okay, and you can see these things. You may need a topical anesthetic, but sometimes all you got to do is pull out the lower eyelid. You can see the little worms crawling around in there, okay? Obviously, in that case, you're going to take the adults out and do an eye wash, and now you've basically gotten rid of the problem because they don't get in the eye unless the eggs are laid by flies on the outside, okay? So that's the treatment as well. All right, does anybody have questions? Hopefully it was just a review, but it's going to be very helpful, especially when you have to go here and take the national boards, because these kind of questions always show up on national boards. How do you diagnose this? What do you do to diagnose that? Okay?